Hello everyone. In this video, I review tirzepatide, brand name Zepbound. This is a once-weekly injectable medication which is indicated for the treatment of chronic weight management as well as obstructive sleep apnea. You will learn about its indications, dosage forms, mechanism of action, pharmacokinetics, contraindications, and side effects. Now, let's dive into this medication in more detail. Tirzepatide, brand name Zepbound. The active pharmaceutical ingredient tirzepatide was initially approved by the US FDA in 2022 for the treatment of type 2 diabetes under brand name Mounjaro. For Zepbound medication, it's indicated in combination with a reduced calorie diet and increased physical activity to lower excess body weight and maintain weight reduction long term in adults with obesity or overweight in the presence of at least one weight-related comorbid condition. In addition, Zepbound is indicated for the treatment for moderate to severe obstructive sleep apnea, OSA, in adults with obesity. Chemically, it's a synthetic 39 amino acid GIP peptide analog. GIP refers to glucose-dependent insulinotropic polypeptide. So therefore, this is a synthetic peptide analog with lipophilic C20 fatty diacid moiety. C20 refers to the tail group for this medication, make this medication more lipophilic, enabling high protein binding with the protein albumin. Therefore, this medication has a prolonged half-life. Molecular weight for this medication is 4,813.53 Dalton. So therefore, this is a very large peptide. That being said, this medication needs to be stored in a refrigerator from 2 to 8 Celsius, which is 36 to 46 Fahrenheit. Do not freeze this medication product. This medication is available 2.5 mg, 5 mg, 7.5 mg, 10 mg, 12.5 mg, or 15 mg per 0.5 milliliter in a single dose pen or vial. Recommended dosage, starting dosage 2.5 mg, given subcutaneously once weekly for 4 weeks. Then increase the dosage in 2.5 mg increments after at least 4 weeks on the current dose. For maintenance dosage, 5 mg, 10 mg, or 15 mg, given subcutaneously once weekly for chronic weight management, 10 mg or 15 mg for OSA indication. Maximum dosage 50 mg, given subcutaneously once weekly. This medication also carries a US box warning, risk of thyroid C-cell tumors. This was based on the animal model studies, based on the rat animal model studies. Therefore, the risk in humans to cause thyroid C-cell tumor is unknown at this point. Mechanistically, this medication works as a dual target effect for both receptors, GIP and GLP1 receptor agonist. GIP refers to glucose-dependent insulinotropic polypeptide receptor. GLP1 refers to glucagon-like peptide 1 receptor. Therefore, this medication works as a dual target receptor agonist. Decrease food intake and appetite. Delay gastric emptying. Pharmacokinetically, absolute bioavailability is about 80% based on sub-Q administration. Tmax, that's the time to reach the maximal plasma concentration, 24 hours, which is ranging from 8 to 72 hours. Volume of distribution at steady state, 9.7 liter for obesity or overweight patient population. For OSA patient population, it's 11.8 liter. Protein binding, 99%. Again, giving this medication contains a lipophilic tail groups, the fatty acid diacid moiety, so therefore make this medication high protein binding with protein albumin. Metabolism. This medication is metabolized by hydrolysis, protein-lytic cleavage, as well as beta oxidation of the fatty acid tail, in addition amide hydrolysis. Half-life 5 to 6 days. So therefore, this medication contains a lipophilic fatty acid tail, making the medication more lipophilic, high protein binding with prolonged half-life 5 to 6 days. So therefore, if you look at the dosage for this medication, it's given once weekly injection. Excretion in the feces and urine as metabolites. Drug-drug interactions. Zepbound delays gastric emptying, may impact absorption of concomitantly taking oral drugs. Therefore, be mindful if patients also take some other oral medications. Zepbound can impact absorption of other oral medications. With regard to contraindications, given this medication is a peptide analog, patients with known serious hypersensitivity to tirzepatide or to any other components within Zepbound product, patients with personal or family history of medullary thyroid carcinoma, or in patients with multiple endocrine neoplasia type 2, MAN2. Adverse effects greater than or equal to 5%, nausea, diarrhea, vomiting, constipation, abdominal pain, dyspepsia, injection site reactions, fatigue, hypersensitivity reactions, eructation, hair loss, gastroesophageal reflux disease. For patients that are on this medication, if they take smaller meals, this may mitigate the adverse effect. These are the key references which I have used to prepare for today's video. Most of the medication information are based on Zepbound prescribing information. This document is available at the US FDA drug website along with the drug manufacturer website as well. Finally, I want to thank you all so much for watching. If you found the video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.